field day for the heat down there. 1,000 people in the street singing song and they carrying signs, mostly saying hooray for our side. There's battle lines being drawn. Nobody's right if everybody wrong. Young people sweeping their mind, getting so much resistance from behind. We got to stop, children, what's that sound? Everybody look, it's going down.
Hello, everyone. This is Lauren Steiner, and welcome to tonight's edition of The Robust Opposition. I have a really good show for you lined up tonight. My guests are John Adlish, who is a professor and a virologist from Nevada, and Will Rodriguez Kennedy, who is the president of the California Young Democrats, and he lives in San Diego, California. And both of these gentlemen have contracted and experienced and survived COVID-19. How are you two doing tonight?
I'm doing well. Thanks for having me.
Hi, Lauren. I'm doing well. Thanks for having me too.
Great. The first question that I want to ask you, and take your time to talk about this because obviously it was a long ordeal, and we'll start with you, Will. Tell us what your experience with COVID-19 was from the very first symptoms through your treatment and your recovery.
Sure. So I started feeling symptoms on, I believe it was March 13th. I've gone through the timeline a couple of times, and it first seemed like a pretty bad flu. That's what it felt like. But you know, I'm relatively young, and I've never had an illness that would like threaten my life, basically. So I dealt with the flu symptoms, and the flu symptoms were, and what was really bad about this one was the and I had the flu this year too, which was suspicious for me. But the fever never was really that high. It was like it hovered around 101, but the symptoms associated with it were really bad. So like, for example, I remember these excruciating body pains where the aches throughout my body, where it was sometimes more comfortable me just pacing around than it was me resting. And that sort of messes with you because like normally you can rest through some of these illnesses. And that was sort of excruciating. You know, I had fevers, I had chills and sweats. Like it just was sort of a miserable illness. And I dealt with that for about 7 days. But that weekend, a number of prominent members of our community, like one of the council members from Chula Vista, which is south of San Diego City, where I live, and who was a friend of mine, had come up and tested positive for the illness. And that caused me to be like, well, because early March, we weren't really talking about COVID-19 as much as we are today. So it was still like this far off concept. And at that point I was like, well, I should probably get tested. So that Monday I got tested at the hospital. Then I got in.
Can I ask you a question on that?
Sure.
With testing? I just want to interrupt because
Go ahead.
Here in Los Angeles, it took a very long time for people to be able to get tested. They were saying they didn't have enough tests, and basically if you were experiencing the symptoms of COVID-19, we were just going to treat you like you had COVID-19. Do you think the reason you got tested so rapidly is because you're part of the VA?
No, actually, we will probably have to talk about that. At this point, I was not covered under any healthcare system. So that's sort of a point that we probably want to discuss. I was thinking that, and I actually got the bill for this test. The reason they allowed me to test is because the county, I believe, sent guidelines and set up these like drive-through test facilities. And if you were symptomatic, they actually said you could be tested. So I called and found that out and like sort of navigated the system. It wasn't easy for me to find like this site or to find out where I could do or if I could get tested. They basically the nurse triaged me over the phone and said, come in and get tested. But I was a little skeptical about this because like, if I got tested, from my understanding, it was like, well, what they're going to do is like send me home because I'm you know, like what does this do for me? But since I'm like in the public, because I'm also the chair of the San Diego County Democratic Party, because I'm like out in the community a lot, people probably wanted to know if I was positive so that they could get tested themselves. And so it's the responsible thing to do.
Okay. So
So,
now,
yeah.
so now let's go back to after what happened after you were tested.
Sure. So I got tested, and then I didn't hear back from them for a while. And then at the end of that week, about 7 days into my symptoms, I started to deteriorate significantly. I couldn't breathe. I was having trouble at this point, and it was beyond something I've ever felt before. And at that point, and it's just like this illness, like you would think by 7 days into an illness, you're basically over the hump and you're trying to get better. But in this illness, it just made worse symptoms. It like evolved or something and became this like worse thing, because the flu is a serious enough illness on its own. But once you can't breathe, like you have something that can kill you. So at that point, I was freaking out because I didn't have healthcare coverage, and I did not. And I had already heard stories that this could cost $20,000-$30,000 if I get into the hospital. And so I was worried about that. And one of my friends who works for one of the local congressional representatives here remembered that I was a veteran, and they're like, you have to be eligible for something. And so they got me into the VA that day, and they enrolled me on the spot, which probably saved my life, because I deteriorated significantly into the evening, where I was unable to. That's when they put me on oxygen. They did like a CAT scan or whatever, and what they could find is that there was a bunch of inflammation in my lungs, and they admitted me immediately after that. And so then I spent 6 days in ICU, and of those 6 days, 3 or 4 of them were really bad. My oxygenation level was low, so at some points they were preparing me for intubation. They were basically saying that, like I remember for one day they put me on I couldn't have food or water, because they were preparing me for, like, there was this weird thing that I couldn't eat or drink. They had me on IVs to like sustain me or whatever, and that was because they were preparing to intubate me. And I fought through it. And there were a couple of times when I woke up and felt like any exertion required me just gasping for air, like freaking out. And then I woke up sometimes feeling like I was drowning. Like I felt heavy on my chest area, and then like I felt like I was breathing, but I wasn't getting enough air. So it was like pretty serious, but I did not want to be intubated, because I just did not want that to be like my last memory. Because and people go into comas after that. So I was freaking out.
They actually put you into comas too. If they put you on a ventilator, they put you into a coma. And 80% of the people that go on ventilators do not survive. And those that do come out, they could have cognitive decline from that induced coma. Okay, go on.
So I was worried about that. I didn't know that like getting intubated was like an escalation in which I did not want to like go. So like they even asked me about this, and I was like, look, give me the oxygen, treat my symptoms, do not intubate me. Like, and I guess I don't know, I got better on like the 4th day in there, and then I started to rapidly restore my health. But it was still like, it was a struggle. Like I couldn't get out of bed without like like it was really bad.
Now, do you have any idea where you might have contracted it?
It's hard to say, because I'm out in the community. I like, for example, like I was on the primary was the week prior to when I started getting sick, or 2 weeks, or just about 2 weeks prior. So that's like at the early age of the incubation, the potential incubation period. And that weekend I walked for 8 different candidates. Like I could have caught it from anyone, like literally anyone could have infected me. I on the election night, I was talking to everyone in our press corps. Any one of them could have infected me. Any one of the electeds. I don't know. It's hard to say where I could have gotten it from.
Yeah. Now, did anybody ask you who you were in contact with? There was no contact tracing of you, right?
So I luckily, when I started showing symptoms, I self-quarantined, because at that point we were learning about that. And so, but when I tested positive, basically the people who had come in contact me, like including the San Diego's press corps, was like, oh, we all need to get tested, because 2 prominent people, me and council member Steve Padilla, got tested, and they were all tracing back in their minds, when's the last time I saw Will and whatnot. The county public health department did call and try to like ask like if there was anybody like could have infected. And so like my roommates, for example, they went and got tested, because they were the ones who were more likely to be seen. And then I told them like the events I had been at. So yes, they did do that.
Now, how are you feeling now? Because I'm reading a lot that people never get back to 100%, or if they do get back to 100%, then they start slipping a little bit. How is your physical health now?
So in the month afterwards, I struggled to recover. My breathing, we're about a month out, a little bit over a month and 5 days out from when I came home from quarantine. And so a little, almost 2 months since I like stopped showing symptoms, and or at least until I started the symptoms, I don't know. But anyways, regardless, it's a struggle. It was a struggle for that first month home. I have an oxygen machine with like the canola and whatever, and I have like 8 portable torpedo-looking oxygen tanks that I'm supposed to take with me if I go out. I had to use that for the first month for sure, and I've been steadily getting better. Now I'm definitely not at 100%. Like I'm like trying to, like, for example, I just started working out again, and I can feel that my lung capacity is not there. And they gave me this little toy thing where you blow into it and it sort of tells you how you're doing. And I'm probably around 90-95% where I was, but it wasn't as good. It's still not there yet. And also I lost, as a result of this ordeal, I lost like 15 pounds. And then now I lost 22 pounds. So I'm okay with that. I'm going to keep that weight off. That's the silver lining, I guess. But it was an unhealthy way to lose 15 pounds.
That exactly happened to me when I got throat cancer 11 years ago. I lost all this weight, and I lost way too much weight. I got down to 98 pounds.
Oh, wow.
I gained back about 10 of it, and that's where I've stood for the last, actually 13 years now. I've been,
Wow.
yeah. Anyway, so John, why don't you talk about your experience? And also, because you're a virologist, you had a completely different experience. You sort of treated yourself. Why don't you talk about your experience from your first symptoms through recovery?
Okay. Well, actually, Will and I had very, very similar experiences, especially the way that it started. So my symptoms began on April 1st, and I'm a person who always runs kind of hot. And I noticed that whole day I was cold, and I was like, wow, I'm just freezing. But April 2nd, I started with this real tight, what I thought was a tension headache. And that headache just became worse. And it got to the point where I started losing focus. By the day after that, which I guess would be April 3rd, I was already losing focus. I was starting to lose track of time. And then the biggest problem was I felt like I had this person inside my brain pushing out. And I had all sorts of issues with balance and walking and stability. And I knew something was wrong. I was running a fever, just like Will said, but I started controlling the fever with Tylenol. And with Tylenol, using the maximum dose per day, the highest my fever got was a 101.4. And I documented all this as a kind of a journal on Facebook. It might be horrible right now because I had no idea what I was writing sometimes. But this mental fog described was really bad. Then I went through this fever that felt like my face, my back, arms, legs were literally just burning like a bad sunburn. And I had 3 days where, just like Will said, the ache, the pain is really hard to describe, but you get these pains and these aches. And that's when I started thinking, well, this is too long for the flu. I started ruling out, rhinoviruses. I didn't have any dripping or nasal or rhinorrhea, anything like that. And I thought there's something wrong. Then it hit my lungs, and I have asthma, so I'm in a high risk group. And at that point, my oxygen levels I noticed were declining, but I was using inhalers. So I had, stockpiled inhalers, and from my work in South America, I had a whole bunch of them. And so I was using the inhalers like nebulizers. I basically converted them to a nebulizer and was able to keep my lungs open, but it kept getting worse. And I started feeling the pains in my upper lobes and in my back, and then slicing pains across my lungs every time I would move. So those were getting uncomfortable. The fever never goes away. I don't know about Will, but for me, the fever and the head stuff never ever went away. It was always there. And that every day you wake up, it's just Groundhog Day all over again. You just started thinking, oh my God, it's still there. So then I doubled up my inhaled steroids for asthma. And that that kind of maintained me for a while. And then I took a crash for 2 days where my oxygen levels were really dropping, and I had a target rate that I would go to the hospital when I hit that target rate, but my pulse also dropped. I remember just kind of going into this trance when my pulse hit 40, and that's the last thing I remembered for hours. And then after that, I had hallucinations and all sorts of things that kind of pulled me out of this. Like I had to move. I knew I had to move. So I eventually tried to move, and then used all the inhalers, got my oxygen. At that point, I got it back up to like 87. And I thought, okay, if it hits 85, I'm going in. But I never got past that. So that night, I couldn't sleep. And then the next night, I couldn't sleep because of that fear of dying. I felt like I was going to die at that one moment. And then the next 2 days, I didn't sleep, but I kept the pains in my chest wouldn't go away, the fever, the headache, disorientation, all that. But on 3 days after that, my oxygen levels started coming up into the 90s. And then I knew at that point that maybe I had passed the quote cytokine storm, and I still had the head trauma, but the oxygen levels started coming up. And so the inhalers, and it takes about 3 or 4 days for inhaled steroids to kind of kick in. And they kicked in, and then, every day I was getting a little bit better. So I hit a plateau of about 95, 96% oxygen. And I knew that, that's good. And then one day I woke up and I was 98. I felt like great. I went for a run and I felt okay. And then the next day I totally crashed and was back in bed, couldn't move. And exactly what Will described, everything was painful. Just getting up out of bed to go to the refrigerator, you're just so tired. I couldn't breathe. I couldn't get air in the upper part of my lungs at all. And so eventually that began to subside. And then the head issues really kept going until virtually the end of the month of April. I spent the whole month with this crazy head thing that is so uncomfortable. And you also lose your orientation and track of time. And it's really difficult to describe, but eventually I slowly pulled out of it to the point where I could breathe. Now and then my doctor actually doubled up my steroids because I ran out because of the asthma. And so now I'm doing okay. My oxygen levels are pretty good, but I still have exactly what Will said. I'm starting to work out again, but you immediately feel it in your airway. So I hope that every day I get a little bit better.
Will, did you have those same symptoms with your headaches?
I didn't have the headache, so I got lucky there. That would have been an extra level of excruciating.
Yeah.
But what he describes with the breathing and oxygenation was completely my experience. There was one point when I dropped it, like I was in the mid to low 80s for a while, which is why they were upping the oxygen for a while.
Yes.
And they sort of kept me at a low 90, 91, which is like barely acceptable, I guess. There was one point when my mask, like when I had fallen asleep and my mask like fell off and I dropped into the 70s. And at that point, I remember a really bad memory, but also showed the heroism of the nurses is that my mask had fallen off and I was breathing. I was like waking up unable, like having trouble breathing. And these nurses, they donned their PPE on, and then they just like threw themselves at me to like find the mask and put it in. And the thing about that is that every time they like get close to you like that, they're risking their health and in order to like save me. And one of my few memories about that time, because I think, I don't know if they sedated me, but I was asleep a lot. And that was that bravery of them to like jump at it and then like get it, help me out. But that was probably the most risky time for me, because at that point they were like, we're gonna have to intubate you, like if you're in the 70s, like this is not acceptable.
Yeah. Well, I mean, it was great that you were able to take care of yourself being a virologist. Can you talk about what a virologist does and specifically what your research is and how that informed your knowledge and way you handled your own coronavirus?
Yes. So essentially, I'm retired from research and pretty much retired from my career. I'm just doing some teaching right now. But what virologists do is to study at the molecular level and the genetic level what viruses actually do to the cell. So how they gain access to a cell, what kinds of cells they infect. And then we also study the transmissibility. We also study the clinical symptoms. What happens if a person is infected with this virus at a particular age or a stage in life, underlying conditions. All of those things are what we do. We also try to characterize how the viruses replicate inside the cells. So essentially at a molecular biological level, which is what we do, we characterize and we tear apart the genetic material to find out exactly how these viruses work, how their genes turn on, how they turn off, how people respond to the infections. Now, as far as my research, my biggest research that I did in virology was to be the first person to identify a cellular receptor for a virus called human cytomegalovirus. And the reason that one's important is that it's a member of the herpes virus family, but it's the most prominent virus that will kill. It's always up in the top 3 or 4 killers of AIDS patients. It's one of the #1 killers of transplant recipients. It is also one of the #1 virally transmitted organisms through the placental barrier. So there's a huge, amount of research going into that. So I was able to characterize that receptor, which I believe was only the 4th or 5th viral receptor ever discovered. From there, I went on to do some other molecular work with the VA. Will's a vet. I did some work with the VA in Reno to characterize this virus and how it affects people in the bone marrow. Because when you get bone marrow transplants, it's very important to make sure that they do not have that virus, if you can make a match to that. And then the other part of your question was, as a virologist, how I dealt with this was knowing my training. Also, I've spent 14 years in the jungle in Peru training with infectious disease physicians, so that essentially, they have given me, through training, the ability to treat with them under their supervision. So I stayed the course of how we treat infectious diseases and certain certain viral pathogens and things like that. That was life-saving to me, because I knew how to keep my airways open. I knew what levels I was going to go get help at. Fortunately, I just barely escaped that. So if I hadn't kept my airways open, I probably would have ended up with a place like where Will was, down in the 70s. And, my target was 85, and then I would have gone in, and I was at 86. So that's keeping my lungs open, with just saturating my lungs with inhalers. So.
Now, let me ask you a question about viruses, because as you're talking, I'm making a connection for the first time that my throat cancer was caused by the human papillomavirus,
Yes.
which, as you know, seemingly like coronavirus, people can be asymptomatic. You can have HPV in your system and never have any symptoms of it. Maybe you just get something benign like genital warts. Or in the case of me, I ended up getting throat cancer, which is really serious. And it was very microscopic. I didn't notice it until it metastasized into a lymph node in my neck. And by then it was stage 3 intermediate cancer. And I feel, and I've been reading stuff about vitamin D and coronavirus, my vitamin D level was very low. It was at 19. And they're saying that vitamin D can prevent a lot of cancers. And now they're saying it can prevent, COVID-19, or it can help with the severity of how someone experiences COVID-19. Can you talk about COVID-19, why some people will be completely asymptomatic and why other people will die from it? And does it have to do with just their age and underlying conditions?
Yeah, let me address your HPV thing really quick. So HPV is a DNA virus, and coronaviruses are RNA viruses. So they have a different type of genetic material. That's all that means. The type with HPV means that the virus's genetic material can be integrated. They carry an enzyme, they make an enzyme that will cut your DNA open and put theirs in. If that DNA goes next to an oncogene, then you're going to activate some sort of cancer. So a lot of people can have just the warts because the virus hasn't integrated into anything that would be cancer causing. If we go back to coronavirus, it's an RNA virus, so the genetic material is a little bit different. So why do some people get sick? There are a lot of factors that go into that. It could be the viral load that they were exposed to. And now they're doing studies on how many viral particles. So one individual virus, we call a virion or a viral particle. So now they're doing studies on how many viral particles can you be exposed to and not get sick, or how many can you be exposed to and get sick. That's one component. How much of the virus are you exposed to? Because with low loads of exposure, you have time to start to make antibody to clear the virus. If you have a high bolus, in other words, a high concentration of virus, you're probably more likely to get sick earlier. Then there's the underlying condition. Some people produce antibodies a little bit quicker. Some people's immune systems, including what we call the memory cells that remember how to get rid of these things, they divide faster. There's your overall health. There is age. As you get older, our immune systems begin to decline with age. But viruses, for example, yellow fever viruses, that's an RNA virus. Mortality rates can vary between 30 and 60% depending upon the strain of yellow fever. So there are a lot of factors that go into why some people get sick and why other people do not get sick. In Will's case, he may have been exposed and carrying the virus before he got the symptoms, and being able and actually shedding, what we call shedding, which is giving off some of the virus in droplets and things like that in saliva before he even knew it. And I think Will, you described that too, that you may have been exposed before you showed the symptoms. Mm-hmm. So there are a lot of factors that go into that, Lauren, as far as why some people get sick and other people don't get sick. It is kind of like other viral infections that we have. So it's multifaceted.
This thing about vitamin D was very interesting to me, because the study that they just talked about out of Spain showed that people that had low vitamin D were more likely to die from it or have more severe symptoms. Mm-hmm. And, vitamin D is associated with immunity. So I don't know how your immune system relates to how you experience the disease.
Well, vitamin D is actually, it's a misnomer, because when it was first discovered, they thought it was a vitamin, but it's a hormone. It's called cholecalciferol. And all hormones have lots of different functions. So with cholecalciferol, I don't know all of those specific functions. You'd have to talk to a vitamin D guy, because that's where we are in the molecular world. Is we're specialized in these different areas, and clearly someone like me, you have to know your immunology, because that ties directly to virology and cellular biology. But I wouldn't doubt that, because hormones play a huge role in how our cells function. So low levels of vitamin D, they've been associated with a lot of other things too.
Yeah.
So it's not just, in the case of cancer. I haven't read those studies on coronaviruses as to, how well people with low levels of vitamin D do or high levels of vitamin D do, but you never know.
I just think it's good to take a high dose of vitamin D, especially when you live in North America and you don't get that kind of exposure to the sun, or especially after, a generation of us, slathering ourselves with sunblock to avoid getting skin cancer. I mean,
you just have to be careful with the dose, because they're lipid soluble.
Yeah,
so they get stored in the liver.
2,000 internal units is what I take every day. I want to go back to Will now.
Sure.
Because I want to talk about your experience with the healthcare system.
Sure.
Bernie Sanders, who we both supported, was talking about, he just has a bill now with Kamala Harris that not just COVID treatment, but all healthcare treatment should be provided during this period. And we know that if we had Medicare for all, the coverage of not just this kind of emergency pandemic, but everyday things that hurt and kill people would lead to better healthcare outcomes. You said that you didn't have insurance, but as soon as you got coverage from the VA, which is like Medicare, it's one single payer, which is very highly regarded. Whatever problems they've had with the VA system, most people are still pretty happy with it. Can you talk about that experience a little bit more?
Sure. So in part, one of the reasons I avoided I mean, I had pretty bad symptoms that if I had medical insurance, so I was on, like, I had left my employer for a while. It was actually sort of a big deal with the CDB and stuff like that. But I had left my employer for a while, and those benefits eventually expired, and it was that month. And so when I got sick, I looked into, like, is it possible to get onto a new healthcare system now because I have the resources to do it? But any one of those like signups required like 30 days or something like that. It took a long time. It takes a long time to actually get covered. And so I was like, well, I don't think that's helpful for me. So I went for 7 days, untreated, largely because getting worse every day, because I did not have healthcare and I could not afford a 30,000 or more medical bill. Like, that's just, it was not possible. Now, once I found out that I was eligible for the VA, then I went in and I had literally the best care possible. I mean, when I got in, they did a CAT scan. They admitted me immediately. I had because I was a high profile patient, I think they, like, the attending physician, which would normally be like whatever doctor is on call at the ICU, I guess, was actually the director of their ICU. So he was like my attending physician, and then like assisting him or like collaborating with him was the chief of infectious diseases. So I literally had the best care possible after getting into the VA. But even then, there weren't many treatment options for them. Like, for the large part, what they did was treat the symptoms in order to prevent like me from getting like injured from something else. So for example, one of the things they found out, because unfortunately one of the symptoms I did have was diarrhea, which is disgusting, but whatever, was a lack of potassium. So like potassium dropped in my system, which I don't even know what it does to you, but apparently it could hurt you. So they, like, for example, among other things, were like injecting through IV, were putting in potassium. But then, which I didn't know, potassium burns when they inject, like, when they do it through an IV. So I had this, like, my entire arm was burning. So at some point they switched me to the potassium tablets, which apparently are like huge, because I basically had to choose between my arm burning and like a choking hazard. And I was like, give me the choking hazard, because the arm burning was just horrible. And, so they treated around the symptoms and made sure that my oxygen was taken care of, and that I wasn't so, and there was nothing at that point. There was literally almost nothing they could do other than treat the symptoms and keep any one of the symptoms that could, in theory, kill you on your own from killing me, while I fought through the disease myself. And I think there was a vitamin regimen that they may have put me on. I had like 4 IVs coming at me at one point. So I don't know exactly the extent of what they did, but I know one of them was for like to keep me hydrated. And there were other things that they were putting in to make sure that I was surviving this. But and then there was like pills that I had to take. Oh, and they injected me, which I was surprised. I forgot what it was for, but they injected me in the stomach every day, like 2 or 3 times a day, to prevent blood clotting. Because when you're bedridden for so long, that could lead to like blood clots. So that was a weird part of this treatment too. But it's another like thing that could, if you got a blood clot in the wrong place, obviously it could kill you.
Now, does this make you want to fight for Medicare for all even more?
Yeah, I've already been down with Medicare for all for a long time, but it also highlights the imbalance of, or the unequal access of services. Like, if I did not get into the VA, so the lucky factor that I happened to serve my country in a time of war, then what would have happened to me? I would have either went to the hospital and took a $30,000 bill, because it's expensive, or B, I would have died. Like, if my deterioration on Friday, the day that they admitted me into the hospital, was significant, I was in the 70s, that could have killed me at some point through the night if I did not go to the hospital. If it wasn't for that, I don't know. And there's so many millions of Americans who do not have that. And so we have this illness that is literally infecting millions, and millions of those people could not have the level of care that I had, or that anybody had. And I could have been one of them.
Yeah, and it's disproportionately affecting people of color too.
Yep. Yes.
Partially because of, access to health care, and also because of other diseases like hypertension and diabetes that they're more likely to have because of unequal, conditions.
Yep.
Everybody wants to talk about now reopening the economy. You know, you have these right-wing groups like the Koch brothers funding these protests that we've all seen. I did a show on that. These are non-organic protests. They're totally funded. You got Steve Mnuchin, you know, the Treasury Secretary, basically saying, if we don't reopen the economy, more people are going to die. I mean, it's just, but we don't have those conditions that I talked about earlier, which is testing of everybody, contact tracing. If we were able to do that, there may be, you know, some sense to reopening the economy. And people are predicting, you know, second waves and third waves. I want to talk about what Sweden did, because Sweden is an outlier. It's one of those countries that we usually, and Bernie Sanders talks about, the Scandinavian countries where they do everything right. They were one of the few countries that actually did not quarantine the people. They just quarantined the sick people. They told the old people they had to stay home, and they told people they couldn't visit their relatives in nursing homes. But everybody else, they just said, go about and do your business and just, you know, be safe. And this, I heard this interview with an epidemiologist who also advised the national healthcare system in Sweden. And he said this, and I actually transcribed what he said. He said, people are not stupid. You tell them what's good for them and they do what they are told. Now, obviously that doesn't describe people in our country. I was out today and 30% of people that I saw were not wearing masks. So do you think that this effort to reopen the economy before there is a vaccine, before they're set up to do testing of everybody and contact tracing and quarantining of those people, do you think that's a bad idea? And you could just speak from your personal experience, your political experience as an official, Will, or your medical experience as a virologist, John, or just as a layperson. Do you think it's a bad idea what we're doing right now, reopening the country?
I'll defer to the virologist first.
I was going to defer to you. But, that is a difficult question, Lauren. I mean, that's really the question. Sweden did lose people. I mean, you know, they achieved things, but they still had deaths. I think that I don't know about the Swedish health system. You probably know more about that than I do, but they still had deaths. They still had a lot of people sick, but they may have achieved, you know, partial herd immunity. My personal opinion in our country is you have to do testing. Put it this way, it's all about testing, and then there's the tracing, and then there's the treatment. But testing has to be done over a period of days. If I take Will as an example, and the first 2 days that he was exposed, he probably would have tested negative, because you still have to go through a point where you get enough of the virus replicating so that we can find it. And then we would have found it. And then days later, we would have found that he was producing antibody, which means he's fighting against it. But at that point, we would still probably find the virus. And then, you know, both you and myself will, you know, 3 weeks later, we're probably just going to find the antibody, which means we're over it. But as far as the economy goes, I agree with what you two have said, that I'm definitely pro Medicare for all. I don't know why we can't do this, because I work in a country that has both systems. We have private and we have socialized medicine, and it's considered a developing country. But yet, if you're sick and you need to go to the ER, you go and you get treatment. And I don't have the answer, but I'm stymied by why we can't do that. And then I think with our style, our capitalism is not set up. And I think Will kind of alluded to this. I think that, you know, our capitalism isn't quite set up the way that you can take care of a pandemic, so that you have universal healthcare. And we're not worried about who's got the supplies and how much they're going to charge for those supplies, things like that. And then as far as opening the economy, you know, that I don't have answers for that. It's a tricky question. I'm glad I'm not a politician. I don't believe we've hit the height of the first wave and we're opening. And I agree with you, Lauren, that social distancing, I've been places now to go grocery shopping, things like that. And there are people walking around with no masks on, families with no masks on, with little children. At the same time, reports of children with Kawasaki disease are coming out. So that's my take on that.
Well,
So
you deal with a lot of public officials down there in San Diego, and we know that while Gavin Newsom has, Trump has left it to the states, and Gavin Newsom's kind of leaving it to the counties to some degree, and even the counties are leaving it to the cities. I mean, what we're doing in LA City is very different from what even the county is doing. So what is your experience down there with San Diego and the reopening?
well, a couple of things I want to sort of like push back on sort of the Sweden narrative, because in Orange County, there are conservative sites who are saying, well, look, Sweden didn't have to shut down their country, so why should we? And there is a significant difference, and it has to do with their system. One, Sweden has a universal healthcare system, so everyone has a better access to care. Number two, in Sweden, they have paid sick days that cover them for a significant period of time. Here in California, I believe the law is 3 days for the year, and in San Diego, it's 5. So in Sweden, they have, I think, weeks of paid sick time, and Sweden's government made it possible for them to work from home and took away that financial incentive to go to work when you're sick, which is a reality for most Americans, particularly in communities of color and poor communities. So if you're sick and if you take that day off and it's unpaid and therefore you can't put food on your table, you're more likely to go to work and spread the disease. But if there's no financial incentive for sick people to go to work, then you're going to bring down the load, because people will then naturally self-quarantine. So there doesn't need to be a law saying that you need to self-quarantine, you need to stay at home, because in Sweden, they have paid sick days that let them take that to do that naturally. And so that's a significant difference. If we wanted to go to a system where we had that type of paid sick days and we had universal health care, yes, we could probably afford to not do stay-at-home orders and all these other things. But that's something I noticed in terms of like looking at what happens in Sweden, and that's an important thing. And also, it's a homogenous country, so it's not quite as diverse as the United States, and so I feel like and also that he did that quote where like if you tell people what's good for them, they'll basically do what you're saying. Sure, except if you have to go to work to put like food on the table, you're definitely going to go to work to put food on the table, even though you're risking your life to do it. Single parents do it all the time. I could think of my mother having to like be sick, take care of the kids, and then go to work, because if not, we wouldn't have food on the table, right? On Mother's Day, that's what I'm thinking of right now. So, and now in terms of like how San Diego has been addressing it in terms of the city and the county has been doing very well. They have opened up hotel beds in order to help people with even quarantining among their housing units. So for example, when I was released to the hospital, I wasn't released home. I was released to a hotel where they quarantined me, because I have 2 roommates who couldn't quarantine if I was here, because there's only 2 bedrooms. So they put me in. They asked me about that, and they put me into a hospital, or into, I keep on saying hospital, but into a hotel, and they provided food, and I didn't see anybody for that 10 days, and I did not. Wow. Therefore, I was able to quarantine. That's a really benefit. That's solely a benefit that the county provided. The city is having a different struggle, because they're not only dealing with like those types of things, but they're also struggling and they're finding a significant challenge with the homeless population. So for example, they recently opened the convention center and housed, I think, 1,000 homeless people in that convention center, which is benefit that they'll have on-site services, but also creates a scenario where you could actually, where people are really in really close contact, and therefore you could actually have a spread of the disease. So there's debate on whether or not they're doing the right thing, because like if they got the disease and they're out all over the county, like they can't be treated, but at least if they're here, they'll have access to quality healthcare. So I'm not sure what's the best approach, but there are actually really good people on both sides of that. And so, I think in general, San Diego County is doing better than most of the counties. And you can see that the differences in approaches from San Diego to Orange County. Now, what they are doing in terms of the city and the county is that they're starting to open up some of the beaches. And and the state is moving into phase 2, which means some of the businesses will open up to, like, if they can deliver services without coming into the store.
Yeah.
Which is good. I think what's important, and what I tell the elected officials, and I tell people in general, is treat this disease seriously, but also take the advice of medical professionals. And California did a really good job, especially if you look at the infection rates compared to the other states. California is very flat, where all the other states are going up. If you look at any graph that shows how Florida, New York, Illinois, like all those other states we are way ahead of them, and we're the largest one. So I suspect that Governor Newsom is taking a measured approach to reopening businesses, because he did well, and that's fine. But they have to, like, really, like, consider those consequences. Now in other states, they're like, let's open up everything because we're going to kill our economy, and it's just, we can't. Millions will die, or like hundreds of thousands will die for sure if we do that.
Texas, and the day right after they opened up Texas, they had the most deaths. The next day, the day after, and the day after that. So I want to move into the vaccine, because the Imperial College study out of London was the one that really freaked everybody out. It certainly freaked me out. When it basically said that how many people were going to die of this, and how long we'd have to be staying in, like 12 to 18 months until they developed a vaccine. Now, some of those models, have not been proven true. They went down, the numbers went down, and then they went back up again. So I guess the modeling is only as good as the data that you put into the models. But I wanted to talk to you a little bit, John, about a vaccine, because this is a novel coronavirus. Obviously, that means it's new. And there are 130 candidates for vaccines being studied right now. And it is very important when you introduce a vaccine that it's safe and that people have trust in it. So do you think that they might end up rushing this vaccine? And what would be the effects of trying out either a bad or an ineffective vaccine? We already have so many anti-vaxxers in this country.
Correct. I just want to say, I think Will figured out the economic thing, and thank you for the information from Sweden. I'll steal that from you. But back to the vaccine, you're correct. There are a lot of companies that are racing to this. Now, in our country, the FDA fast-tracked a lot of these vaccinations. So this is a twofold approach. They've fast-tracked things. And the second component is that over the last decade or two, we've become better at manufacturing them. So there is one company that's starting phase 2 clinical trials. So everything went really well in phase 1. And you can't get clearance to go to phase 2 unless you have the confidence results from phase 1. So they've gone into phase 2 and they're doing really well. We're going to know more. Other companies, it depends on what the vaccine is. So how the vaccine's made. Is it an RNA vaccine? Is it just a recombinant vaccine with the major protein on the cell, on the viral surface, which is the S protein? It just depends on what vaccine it is. The third component is how long will you get protection? And you don't know that until you get way past, into phase 3 clinical studies. So it could be 2 months, it could be 4 months, it could be a year. If you do have a faulty vaccine, yeah, you could have adverse immunological reactions, but I don't know that they would necessarily proceed past phase 3 if that were the case.
Okay, now this is I'm taking some questions from people who are skeptics to yeah, I've got, you find a lot of people on the extreme left or with the extreme right on this. I basically having had a cancer and having toxic radiation and chemotherapy treatment for that to save my life, with the kind of quality of life side effects that I will have for the rest of my life. I have no patience for these people. If there had been a Gardasil vaccination when I was a kid, I would have spared all this, okay? But these same people are the ones that are, posting all this conspiracy stuff, and it gets onto YouTube and people start believing it. So I don't know if this is a conspiracy thing that my friend, who's very suspicious, he says he's not anti-vax, he's just vax cautious, or whatever term he used. he wrote this, and I respect him in a lot of other areas, so I want to give you an opportunity to address it. He said, vaccines are not effective on C-type viruses, which is what this coronavirus is, because they mutate and branch into different strains, and there's already 14 strains, and the other strains can be more contagious. So can you address that?
Yeah, first of all, I would ask him which viruses he's talking about. For example, if he's talking about C-type viruses, is he talking about just the coronaviridi? That's the family that coronaviruses are in. All viruses have different strains. That's why we do an annual flu vaccine, because there are minor mutations that occur in, and by the way, influenza is an RNA virus as well. That's why we do those vaccines every year. But I want to go back to the, vaccine skeptical. That's sort of like being kind of pregnant. So if you're not opposed to vaccines, then you would get a vaccine. And that would include flu, and that would include measles, mumps, rubella. And what I say to people is that we have to educate the public as to these things. And I teach my students this. How many cases of smallpox have you seen? How many cases of polio have you seen? Why? And the answer is vaccines. They didn't live through smallpox. They didn't live through polio. So we have a short memory because we don't understand what the effects of those things are, how devastating those viruses were. And you don't see those because they're gone, pretty much. Polio is close. It was supposed to have been eradicated a few years ago, but because of wars and political controversies, it's not. But it's pretty close. Smallpox has been eradicated. So how was it eradicated? It was eradicated by vaccination. And that's my answer to those people. You kind of can't have it both ways.
Okay, so now I want to talk to you about gain of function, because that's another term that I've just come to learn, which is that gain of function research was being done at the lab in Wuhan. And they're saying that, and Trump is trying to do this, of course, he's trying to say that this was manufactured in China because he's trying to blame China and he's trying to take the blame off himself. But this argument is a little bit more nuanced. There's other people on the left who are saying this is a bioweapon, and they were engineering it in Fort, whatever that fort is, Fort wherever in Texas, I forget the name of the place, and they were working
Fort
on
Bragg or,
not Fort Bragg, that's in California. Fort Diggs, Dix.
Yeah, something like that.
Well, anyway, so they were doing what's called gain of function tests. And from what I understand, and you can explain it better, but just my layperson's understanding is gain of function tests are done on these viruses to, figure out how to treat them, how to cure them, how to develop a vaccine for them. And it mutated into something, it got out of hand, and it was released accidentally. It didn't come from the market in Wuhan, and so what was sent to me was an article in Nature. And I said this to you, I'm not going to read you the entire thing, but just to give my viewers how a person like me who really wants to try to research something and understand it cannot possibly do it without a medical background. This is an article, is SARS coronavirus to a man-made virus? How is it that the envelope glycoprotein GP120 from HIV is part of SARS coronavirus 2, ? Our analysis of the spike of glycoprotein of 2019 nCoV revealed several interesting findings. First, we identified 4 unique inserts into the 2019 nCoV spike database. The uncanny similarity of novel inserts in the 2019 nCoV spike protein to HIV, GP120, and GAG is unlikely to be fortuitous. And then it goes on and on and on, which I'm not going to bore everybody with reading, but my eyes are glazing over. I don't understand this. All I see is that it's in Nature magazine, another article, because there were 2 I sent you, to examine the emergence potential, that is the potential to infect humans of circulating bat COVs. We built a chimeric virus encoding a novel zoonotic COV spike protein from the RSSHCO14 CoV sequence that was isolated from Chinese horseshoe bats, one in the context of the SARS-CoV mouse adapted backbone. And then it goes on to talk more about how they created this chimeric virus. and I don't want to again bore people because I've already bored, but I'm telling you, this is so
Yeah.
scientific, and Nature is a legitimate science, magazine.
Yes.
Already now there is a disclaimer on Nature to say that we know that people are using this article as evidence that it was man-made and not found in Nature, and we're discrediting that. So that to me is political. That kind of political disclaimer, I'm going to discount. So I'm asking you, I'm going to the source here. What is your opinion? And also that this gain of function research is very controversial. There were guidelines against doing it, and Fauci was doing it anyway. And there's all sorts of bad stuff about him and HIV, which I'm not even going to get into because we don't have time. Mm-hmm. But what is your opinion, A, about gain of function research? Was this being done? Could this have possibly happened? And really, does it even matter at this point?
Well, the short answer, without getting into all the science, is I don't think it matters. I'll tell you this, that these sequences, in other words, the genetic sequence, the chemical building blocks that we refer to as nucleotides that make up these viruses, which are roughly 30,000 long. That's small. A human has 1 billion base pairs, so 2 billion of the building blocks. Those have been sequenced. And SARS-CoV-2, which is the COVID-19 is the disease, and SARS-CoV-2 is the actual virus. But those have been sequenced, and there's no sign, and this has been published, there's articles on this, there's no sign of any sort of genetic engineering manipulation that goes along with that. That's been proven. Now, when we genetically engineer something in a virus, for example, if we want to study the receptor interaction, in other words, how the virus gets into the host cell, the human cell, then we do a lot of different things, a lot of techniques. So a lot of those things you're citing refer to the amino acid sequence in the proteins. These are all proteins for the viral spikes and surface proteins and things like that. Those are all proteins. They're made up of amino acids. So for the lay person to read that is going to be really difficult. I mean, it's going to be very difficult. And I don't even know how to address that except to say that we are undereducated as far as science goes. And we have this backlash against science right now. Well, I don't believe it, and it's because I don't understand it. But that doesn't mean that it's not correct because you don't understand it. So there's really no evidence that it was laboratory. The evidence actually points to bats infecting humans, and the coronaviruses, by the way, are the reservoir for those, which means where they're continually found is bats. So it's pretty clear that bats infected a person, and then a person may have gone to the market, and then other people got infected. And as you've seen, it's highly infectious. I read one of those articles, which is just a classic article of trying to figure out how the virus gets into the cell. And what people don't read in that article is that there is a paragraph in that article that talks about how these coronaviruses from the bats also were found to infect cells in the upper respiratory system of humans and mice and different things. And they go on to list all the different kinds of cells. So, bats are mammals, humans are mammals, and zoonotic infections do cross. I mean, that's how we got HIV. It was from African green monkeys. It was a simian virus, monkey virus first, and it crossed the species boundary. That happens a lot in virology. It happens all the time when we go into new areas and stir up things and get into places that we haven't been before. And that's my short answer, because to explain the science, I think you'd have 2 shows to do that.
I wonder if I could address the political
Sure.
argument. And I would address it, especially with vaccine skeptics, I would address it with math. The mortality rate for coronavirus is around 2.1%, which means if everyone were to get sick, 6 million Americans would die. But the mortality rate, or the effect with deaths in vaccines, is 2 per million cases, which means if everyone if everyone were to get a vaccine, I think 600 people will die, right? And so the consequences of being skeptical and creating policy that is responsive to vaccine skepticism, which is the nice way of saying what they are, is disastrous. by on the order of millions. So that I hope people like look at that, because there's a lot of body of study that's available at the National Institute of Health on their website that shows that they did, for example, a test of people who 7.6 million people who were vaccinated, and only 5 cases of some sort of complication of that vaccination. So like, alternatively, if all those 7 million were infected with coronavirus, like thousands and thousands of people would have died, right? So like, that's what I just want to make sure that when people may not be able to understand the science of that when they're thinking about policy, and fear breeds when people can't understand things. But let's talk about the math, which is very easy to understand.
Yeah. All right. Well,
I agree with that.
We're going to have to leave it at that because we've gone over our time, but I just thought the discussion was too interesting to cut it short.
Okay.
So I want to thank you both for being on the show. And I wish you well in your continued recovery, and may you never have another symptom again. May you never get reinfected again. I want to promote my next show, which is going to be Tuesday, and it's going to be at a strange time. It's going to be at 2:30 Pacific time, because that's when my guest, who's on the East Coast, is available. And his name is Bruce E. Levine. He is an author and a clinical psychologist, and he wrote a book called Resisting Illegitimate Authority, A Thinking Person's Guide to Being an Anti-Authoritarian, Strategies, Tools, and Models. He also wrote an article about shit life syndrome, which I shouldn't laugh about, because that's just another way to talk about diseases of despair, and how the people that voted for Trump in 2016 really are those forgotten people who don't have the education to do well in our knowledge-based economy, whose jobs, manufacturing jobs were outsourced, and who have taken to alcohol or opiates or suicide even. So I'm really looking forward to talking to this gentleman. And again, I want to say thank you, and tell all my viewers to please share the show, because I'm in Facebook jail yet again. So everybody stay safe, stay home, except to do the things that you're permitted to do, and keep fighting.
Thank you.
All right. Thank you, Lauren.